This conference will now be recorded.
First of all, I want to welcome everyone to, I believe, our 30th COVID conference call. For those of you who don't know who I am, I'm Wayne Mitchell, and I'm the President and CEO of the Nacogdoches County Chamber of Commerce. I want to let you know that we are recording this call, as you heard a moment ago, and members of the media have been invited to participate on this call as well. I'd respectfully ask that everyone on the call, please put your phones and or your computers on mute until we're ready for the question segment of the call itself. I want to remind you that the Chamber has a wealth of information on the Chamber website at www.nacogdoches.org. Please visit the COVID-19 resource page. We'll begin with our first presenters today. We'll use the same format as we've used in previous calls. I'll present questions to our presenters and ask them to respond. I will open the forum at the conclusion for questions from participants. If you have questions, feel free to either use the chat section to submit your questions or feel free to unmute your phone and to present the question when I call for them. I'm pleased to welcome two individuals that have, in my opinion, the greatest responsibility for COVID management in Nacogdoches County. Jeff Patterson, the CEO of NMC Health Network, and Gary Stokes, the CEO of Nacogdoches Memorial Health. I've had the privilege of working with both of these two talented colleagues, and they both serve on the front line, and we're fortunate to have them on the job today. I'll start by welcoming both Gary and Jeff to the call, and I'll ask if either of you have any opening comments. Gary, do you have anything you'd like to say as a start to this conversation?
Well, I appreciate being included, and I think Jeff and I have talked a little bit about kind of how we've approached this, so looking forward to it. Thank you.
Thank you, Gary. And Jeff, I assume you're on the call. Any opening comments on your end?
Yeah, thanks, Wayne. Appreciate it, the invite today, and just a significant amount of appreciation for our first responders, people working, fire, police, EMS, nursing, doctors, registration staff. It's been a long haul so far, and we're not, fully out of the woods yet. So just thanks to our first responders. Very much appreciate it.
Thank you, Jeff. Jeff, why don't we, I'll pitch the first question and give Gary a chance to respond as well. But with the recent spike in COVID cases here in the United States, how would you currently evaluate capacity issues in your hospital?
Thanks, Wayne. The way that we are evaluating our capacity, hasn't changed. Resources that are limited are things like beds, whether they're ICU beds or whether they're medical surgical beds, obviously ventilators, PPE, gowns, masks, etc. But I would say probably the most precious resource is staffing. And so those are the kind of different things that we look at in efforts to make sure that we can handle whatever spike or whatever census is necessary for our facilities. And, I say this interestingly, but we were fortunate to kind of get hit as hard as we did back in April because it really made us think about our resources in the most expansive way. And since April, we have not been tested as hard as we were tested in April. However, we do have significant capacity to grow. Right now, we're currently at half of what our max was back in April within medical center. So we have significant resources through all of those different variables to increase if necessary.
Thank you, Jeff. Gary?
Yeah, I would say generally our capacity issues at this point are good. However, as Jeff alluded to, we do have some issues in certain areas. Critical care is certainly one. Staffing is a major consideration. We're both recipients of state employees. Without those state employees, I'm not sure that either one of us would have been able to survive what's gone on. So that's a big issue for us. In Memorial, we also have monitors are tight for us. And I had a kind of a quote from our ED director that said that we've been on diversion, more in the critical care diversion, more in the past 10 months than she has seen in 20 years. So it's obviously a critical time, but I think that we're sitting in a pretty good position. And we're fortunate we have an extra floor that we have beds, but we don't have the staffing. So if it was a huge spike, we'd have to get supplemental staffing and could handle more on the capacity side.
Gary, is Nacogdoches receiving the required technology and medicine to address COVID today?
I think, yes, our inventory levels for all our drugs used to treat COVID-19 are adequate to run about 3 to 6 days of supplies on hand. Pepsodent 20 milligram IV has been in short supply, but we have received a large backorder shipment, so supplies are back to normal there. Remdesivir injections, they're used for the COVID that people heard about. We're now using it's called ASD Healthcare, which is a national wholesaler. So that has been good. I guess the next thing everyone's talking about is the distribution for the vaccine when it becomes available. That's going to also be distributed through a single national wholesaler. And I think you've heard President Trump saying if he's elected, they would use the Army to work with that person to distribute out to the hospitals. So when it's available, they're anticipating end of the year, but there's nothing definitive on that yet. So that's kind of where we stand.
And Jeff, your reaction to that question?
Yeah, same here. Pretty in line with Gary. We, first of all, thanks to Travis and a lot of the local support in helping us get that early dosage for remdesivir. That as a therapeutic has been very effective, as the FDA stated, in treating the COVID-19 virus. And when it comes to, resources we have, I feel very comfortable with the required technology and medicine. I think the only thing that we don't have here that some of the bigger cities would have would be extracorporeal membrane oxygenation, which is ECMO. And as you guys probably are aware, the nearest places for that would be Houston, Shreveport, and Dallas, Fort Worth Metroplex. And year to date, we've had 2 patients transferred out to DFW for ECMO. So that's really the only thing I believe we're lacking.
And I don't know if you were on the phone when I was talking to Gary earlier, Jeff, but I do want to give all of the folks on the call a heads up that next week's call, we will be featuring Stephen Anderson, who is the president and CEO of the National Association of Chain Drugstores. Steve was on a national conference call last week. He's an old colleague of mine from my U.S. Chamber days. And he and I connected, and he's agreed to join us on the call. You might have seen him on the Today Show and CNN and Fox News and other national shows. I'm particularly interested in trying to determine what role the stores will play in the distribution of a vaccine once and if it becomes available. And Steve certainly is equipped to be able to help us. So I hope all of you folks will join us next week for that call. It's going to be very interesting to have him on there. Let me just ask this question. In general, what are your major concerns, Jeff, at this point?
Major concerns would be that, we have a 3rd or 4th spike that is greater than our first, that would potentially cause us to shut down medically necessary care, to make sure that we have the adequate resources to carry for that 3rd or 4th surge. But to be honest with you, my biggest concerns right now are burnout and fatigue for my staff. My docs and my staff, they've been on this for 8 months straight. This is a grueling pandemic, and these folks are, seeing some really tough stuff on a daily basis. So my biggest concern is dealing with burnout and fatigue for our medical professionals.
Gary?
Yeah, I would definitely agree. And I think that because of the burnout and the fatigue, the manpower is kind of like the #1 priority. And we have like 16 state nurses and 3 respiratory therapists, and this hospital couldn't continue doing what we're doing if we didn't have those folks, and I'm sure Jeff feels the same way.
Very much so. Thank you.
Gary, is there better coordination between local, state, and national agencies? And have we somewhat reduced the confusion since our last conference call about the threat and treatment of the COVID virus?
I think it's generally improved, although I think that kudos to the state rep and the senators, which include Travis Clardy and some of the other folks that stepped in when we had that confusion regarding the governor's executive order, in which we have dealt all through this process with an organization called CTRAC or SETRAC. And then they moved us to a trauma group, which was a grouping of 7 hospitals in the area, which included Angelina County and Nacogdoches County. So they got 4 of the hospitals out of the 7. And then they applied this bed capacity, anything over 15% of COVID on your bed capacity, 7 consecutive days, then they turn back and penalize or go back to more restrictive with the community as far as restaurants, different types of things like that. So Monday we were at, once you go back below 15, Monday we were 10.3, you start over again. So with these spikes going on, and I think that was probably the most confusion that I had experienced trying to get a handle on this and trying to work with it, because they, in essence, will shut down all your elective surgeries and penalize the community if your percent's 15% and over for 7 consecutive days.
Have we brushed up against that percentage, Gary?
Oh yes, we were. I think the longest time we maybe had a 5-day run where we were over the 15%, and then we dropped back down. So I'm not sure, just probably because we're obviously in the same community, pretty much the same. But you have to keep an eye on that. That's a key indicator.
Jeff?
Yes, as Gary stated, moving on to DA Executive Order 32 from 31, I think really made a difference, and we wouldn't have had that without coordination between local and state officials. Again, to what Gary was articulating, we were on the cusp having 5 days straight of over 15% of our overall admissions being COVID, which if it had eclipsed 7 days, we would have had to move our openings from 75% to 50% and also restrict medically necessary care. What took place was local and state government officials got together and said, hey guys, this metric doesn't make sense. It really needs to be 15% of your overall capacity, not 15% of your overall admissions. And so that coordination made the difference, not only in keeping medically necessary care going on, but also in keeping our businesses moving.
And Jeff, is there anything that the business community can do better to reduce the impact of COVID?
Expect your customers to follow the rules. I'm a consumer of many goods in many of your businesses, and there are some businesses which hold customers accountable to masking, distancing, and hygiene better than others. And so I know it's not comfortable telling a patron to do something that may cause them to leave, but that is the only advice I can give that would help slow the spread.
Gary?
Yeah, I would say the key is the masks. As much as we hate them, masking and social distancing. The virus is airborne, so your best protection is to make sure you have the mask. And then the second thing I'd add is don't forget that the hand washing is extremely important, and do it as much as you can and as often.
And Gary, what is the mortality rate trends as it relates to COVID at the hospital? Is it less? Is it about the same, or is it greater?
Well, our spike, when you look at the, for instance, like if I looked at our deaths, that kind of runs with, I think we've only had about 32 total in that regards, but our spike was in August, which we had 7, and then in September and October, the last 2 months, it's been 3 each. So mortality is obviously, it's a reality, it's there, but it is on the decline.
And just as a follow-up, do you suspect that the decline is because of better treatment, or in terms of we know?
I think
what
it's
we're
a combination.
dealing
I think certainly better treatment. I think that the mask and the other things are going on.
Yeah.
I think all the testing and you know, identifying has helped also.
Mm-hmm.
Wayne, I brought my Nacogdoches County Dr. Fauci, which is Dr. Tony Thompson, who's my chief medical officer here. I think he can comment more on the therapeutics and age and other reasons.
Yeah, Wayne, I think we had in April, and then again in July and August, we had these surges, and I think numbers are going up, now. But as far as mortalities, we're seeing less mortalities now, and I think it has to do, one, Gary mentioned, better treatment. We've become pros at taking care of COVID patients. In 8 months, we've learned a lot. And, this is a brand new disease, and so we've learned a lot. We've become more efficient. But we're also seeing a different type of patient that's infected. It's more, early on, it was a lot of long-term care patients, and now we're seeing community spread, and we're seeing a lot of younger patients. And so I think those two reasons, the better and just population now that's getting infected, is why our mortality rate's down.
Thank you, Tony
Dr.
Thompson.
Appreciate that. Any other comments, Jeff, on that?
No, I agree with the therapeutics being more effective as we've gotten more astute at treating the virus, and then also just the age difference. I mean, it is still a very deadly, devastating disease. I don't need to ask any of y'all to turn on CNN or Fox News or any of your local stations or the internet to see, what kind of impact it's had locally, statewide, and nationally. However, I believe in telling you that we are seeing a younger population and a decreased mortality and better therapeutics and treatment as, truth.
And Jeff, is testing still a challenge?
No, testing is not a challenge really at all for us. I mean, it's evolved immensely. You remember early on in March and April, people were waiting up to a week to get testing back. Probably since sometime in early May, mid-May, we've had, access to rapid testing and been able to get testing results within, the hour. So that has not been a problem for us. I think what you'll see and hear a lot more about now is the ABC test, because now people are going to be looking at, do you have flu A, do you have flu B, or do you have COVID? And so we're currently in the process of finalizing our kind of justification for those tests, and we'll have that available here very shortly.
Gary?
Yeah, ours has been a little bit different. Jeff was fortunate to, have a machine. At our point, we did not have a machine, and we do have so we send them out, so it's not as rapid as turnaround time. So we've ordered a BioFire machine. We had a donor through our foundation that has helped us out with that. The problem was the crazy machines were on back order, and so we have the machine now. We're assembling it, but we've got to go through calibration. So hopefully in November, the BioFire machine that we have purchased will be operational, and that will substantially help us. And it's probably been one of the biggest challenges we've had by not having that machine when this thing hit.
Thank you, Gary. Just in general, one of our participants has asked, besides staying safe, is there anything we can do to help with the short staffing challenge that you both are experiencing? Jeff?
That was a good question. Yes, if you have family members or friends that are looking for a lovely vacation to East Texas this time of year, we would love to house them up and give them an opportunity to help treat the patients in Deep East Texas. That is, as Gary and I both mentioned, our biggest concern, not only making sure we have enough staffing, but also that we keep our folks rested and out of burnout.
And Jeff, what type of skill set should these people have in an ideal world?
Critical care and emergency department and medical surgical registered nurses.
Okay. Gary?
That's exactly the same. We're in tandem there.
Same situation. I'll open it up for questions from our participants. Anybody have any questions for either Jeff or Gary? Well, Gary and
Hey,
Jeff,
wait.
go ahead.
Wayne, this is Rusty. Gary and Jeff, do you see any scenarios? I mean, here what's happening in El Paso, which is, thank goodness, further than Chicago from us. But do you see scenarios where we get an early lead on that, so that doesn't happen in our community where there's that kind of outbreak?
Hi, Rusty, this is Jeff. It's tough. We're going, school going, open business, kind of mentality here. And the reality is that obviously the lowest that we've seen the numbers has been when we were on lockdown, and the highest we've seen them and when there weren't any restrictions at all. So I'm kind of a believer in kind of finding a good middle ground. And the middle ground is keep going to church, but wear your mask. The reality is keep opening your business, but have people follow the rules. The reality is keep going to school, but be thoughtful about your hygiene and your distancing. So it's almost overly simplistic, and I hate to repeat, but I want businesses to be open. I want businesses to be thriving. I want my kids in school. I think it's good for all of us, but we've got to be thoughtful with using the protections that we have.
Gary?
Yeah, this is Gary. I would mimic the same thing. And I don't think an El Paso situation, East Texas, just because of the mere mass and the numbers of people are so much more that I would not anticipate anything like that here in East Texas. But you've got to do exactly what Jeff said. You got to do the masks. You got to do the social distancing. And I think people are tired of it. They get lackadaisical. That would be the major caution.
Thank you.
Teresa Darby asks, can volunteers do anything to help in your staffing situation?
Well, in our situation, most of the volunteers in hospitals in America are kind of senior citizens. So because of the age and their susceptibility, we haven't had volunteers in the hospital. From our normal organization, if there were, and there's not, since we're still limiting visitors to a degree as far as on exception basis and all. Before, people were doing a lot of mask and all, cloths and different, masking. That was helpful, but I think we have plenty of that right now. Maybe prayers are probably the biggest thing.
Well said, Gary. Well said. I mean, again, anything, you got neighbors, you got people, you got organizations. I mean, the other, one of the organizations we haven't talked about too that was, hit very hard on the front end were long-term care facilities. So, keep everybody in your prayers. And then also there's volunteers, food, other things you can do for those frontline responders. Those are definitely appreciated.
Well, I always love to end a segment on an amen. And certainly I want to thank Gary, you and Jeff for the leadership you're providing. And hopefully things will continue to trend in a more positive, direction here in Nacogdoches, and that we all pray that we have a vaccine as soon as possible. But thank you both for the leadership you provide to your two hospitals and to you and your staffs and colleagues. We very much appreciate all you guys are doing. We'll move on.
Thank you,
now.
Wayne.
You're quite welcome. We'll move on now to the next presenter this morning. Would you welcome with me the president of Stephen F. Austin State University, Dr. Scott Gordon. Good morning, Dr. Gordon.
Well, good morning, and great job to Gary and Jeff. And, going into this academic year, one of the main goals I had was to not stress out Jeff and Gary or their hospitals. And knock on wood, we've been able to not stress them out. And we have 17 more days before our students head off for Thanksgiving. And those students will be in remote instruction after Thanksgiving. So 17 more days, and I'm feeling pretty confident. Right now, we only have 4 of our isolation spaces being used. That's 4 out of 200. And we still are down to about 10 cases, active cases of COVID-19. So I'm extremely proud of the faculty, the staff, the students, really everybody who's taken the protocol seriously. And as a result, again, I'm very confident we'll be able to make it through this semester. And no refunds or any of the kinds of things we saw last spring. And that's a good thing. Many of you probably saw the news release about expanding our programming at the Rellis campus of Texas A&M over in Bryan. That's going to be a phenomenal program. It will be the only early childhood through 6th grade education certification program in that whole area. And it's going to draw a lot of the Blinn College students. And so we're very excited about that. So we're expanding in that area. Pretty soon we'll be announcing a couple of other campus expansions down in the Houston area. And again, that's where population is growing, and the whole concept is to essentially own the entire I-69 corridor from Houston to Texarkana. So we're well on our way for that. We also, many of you probably have heard about the grant that was submitted, and I thank a lot of the people on this call, and specifically Larissa for all of her help in getting letters of support. But that's a grant. We should hear something later in the month, but it's $4.5 million, and that's going to refurbish the Science Research Center off of I-59, which will actually be on I-69 when I-69 is completed. And that will be that one-stop shop where the university will interact with the community in applied research and other projects, and really helping to further entrepreneurship in the area, businesses in the area. And we're excited about the possibilities of that center. So that's all I have, and I'll take any questions.
Thank you, Dr. Gordon. Dr. Gordon, when do you anticipate the students coming back from the Christmas break?
They'll be coming back and starting, I believe it's January 8th. I'll have to look on the calendar here, but it is, it can't be January 8th. That's a Friday. So somewhere there in kind of the January 4th to 10th area, somewhere around there. And we anticipate having a fall semester very much like spring semester. We'll have a lot of online, a lot of hybrid, and a lot of face-to-face, about a third each. And our residence halls will be open. Our calendar will be the same. At this point, we're planning on having a spring break, and hopefully by that point we'll have either a vaccine or some other therapeutic, so that we'll be able to stay in session the whole spring semester.
Well, we all pray that's the case, and thank you, Dr. Gordon, for that great partnership with Texas A&M, and we look forward to hearing more about that as it progresses. Representing the Office of the Governor, would you say good morning to Betty Rousseau, please? Good morning, Betty.
Good morning, everyone. I hope you're all doing well. I have a few things today. The Governor's Broadband Development Council issued its first report to the Texas Legislature. It was submitted very recently, and the report includes recommendations for the 87th legislative session and provides an overview of the work it's done since its inception. They researched the progress of broadband development in unserved areas, identified barriers to residential and commercial broadband deployment in unserved areas, studied technology neutral solutions to overcome barriers, and analyzed how statewide access to broadband would benefit economic development, higher education, public education, state and local law enforcement, state emergency preparedness, and healthcare services. Another one, the Texas Department of Agriculture announced several competitive grant applications for their 2021 Texas Community Development Block Grant programs, including the Community Development Fund, Colonia Fund, Construction Program, and Downtown Revitalization Program. Applications for all three are due on May 3rd. And there's going to be some webinars to introduce and provide technical assistance for these application cycles. There is a federal fund for communities, the Community Connect grants. This is funding up to $3 million to construct facilities used to deploy broadband services to residents, businesses, and essential community facilities such as schools, libraries, fire stations, and etc., or to cover the cost of providing broadband service to community facilities for 2 years. And there's an upcoming economic recovery webinar. It's how broadband enhances local communities. It's put on by Broadband USA. While communities adapt to the challenges brought about by the coronavirus pandemic, economic development in rural America has been hard hit. The difficulty exacerbated by the lack of broadband. Join to hear how communities and broadband providers are working together to expand broadband access to residents and businesses to build resilient economies. And that's it for me today. I appreciate it.
And thank you. And that's interesting information about the broadband, Betty. We'll look into that. That's great news.
Thank you.
Any questions of Betty? I do see that President Gordon has indicated spring classes do start Friday, January 8th, for those of you that are interested. I'm pleased to see that we've been joined by our city manager, Mario Canizares. Good morning, Mario. Anything you care to contribute this morning, sir?
Hey, good morning, Wayne. Good morning, everyone. Just a quick update. We've got our city council meeting tonight, our first what we call a hybrid meeting, which will have 3 council members present in person, and we'll have a couple of them virtually. So the council chambers has been slightly modified with some plexiglass barriers at the dais, and we've spread out the seating along with the other tables for staff. So the look and feel of council meetings will look different, but yet we'll be able to have some of those meetings now in person to some degree. The other real quick piece for tonight is we have an item that's being presented by our fire chief. It basically is to approve some funds to do a fire station location study, and we've got 5 fire stations in our community, and one of those is built in close proximity to I-69, which I heard Dr. Gordon mention just a little bit ago. And so really it's about just looking at the response times along with how our community has changed over the decades, and also as new roadways and other pieces of infrastructure are built, how do we respond going forward for our community as it continues to evolve. So that'll be on tonight's council meeting for council to approve those funds to do that study, and hopefully that study will be completed within a 6 to 8 week period, and then we can start planning with our city council members going forward on how to address the recommendations from the consultant. Otherwise, if you have any questions, be happy to answer them.
Any questions for the city manager? Mario, thank you very much. Appreciate that update.
You're very welcome.
Would you say good morning, please, to Larissa Philpott, the president and CEO of the Nacogdoches Economic Development Corporation? Good morning, Larissa.
Good morning, Wayne. Got 2 exciting events to remind everybody of. I think I mentioned last time, but I want to remind you all, we have the Imagine the Possibilities tour coming up on November 6th from 3 to 5, November 8th from 1 to 3. We are hoping to get some interest in our downtown buildings that are vacant and for sale or for lease. And then also NEDCO is hosting our business accelerator. It's a little different this year. Typically it's a several week-long class, but with COVID, we're trying to adapt and see what fits. And so on, goodness, I think I just wrote the date down and I missed it. I believe it's on November 10th. We have one-on-one speed rounds where you can meet with experts, kind of like speed dating. If anybody remembers what that was like, you have a couple minutes to sit down with a banker, a small business owner, somebody that's experienced in marketing, for example. And so that will be from 5:30 to 7 p.m. at the C.L. Simon Rec Center. If you're interested, please go to nedco.org to register. That's it. Thank you, Wayne.
Thank you, Larissa. I appreciate that. I haven't speed dated in quite a while, so I may just join that forum to see what it's like. So, Representing the hospitality industry, would you say good morning to Sherry Cheney Morgan, the Executive Director of the Nacogdoches CVB? Good morning, Sherry.
Good morning, Wayne. Good morning, friends. We're still seeing lots of visitors come through our visitor center here, including several who are looking to relocate to Nacogdoches, either for retirement or otherwise. So that's always nice to see and encouraging, certainly amid this global pandemic. It is not too late to submit your love letter to Nacogdoches for our special project that we hope to launch in January. Please share with us what you love most about the oldest town in Texas. We are now currently in the second week of 9 Weeks to Nine Flags Christmas celebration. Follow us on Facebook to keep up with the highlighted flag of the week and either learn or refresh your memory about our rich history. And I want to end my report by acknowledging our amazing community partners who stepped up by sponsoring our traditional Nine Flags Christmas trees. The very first one that got us started was Texas Forest Country Partnership. They will be sponsoring our Industry Confederate Stars and Bars tree. Knack Space will be doing the Spanish tree. House of Photography, Peacemaker Studio, and the newly opened Cottage Wine Bar will be doing our French tree. JB Construction and Humphreys Real Estate will be doing the Mexican tree. The Rebellion tree, which covers the Gutierrez, McGee, James Long, and Fredonia Rebellion, will be done by the Fredonia Hotel, Red House Winery, and Fredonia Brewery. The Lone Star flag tree will be done by the Texas Forest Trail region. And the United States flag tree will be done by ETX Life. So thank you all to those generous sponsors that are going to help make the Charles Bright Visitor Center a holiday anchor for the community and will be providing us new and rich content to entertain our guests and visitors with. Thank you very much and have an awesome week.
Thank you, Sherry, and I'm looking forward to seeing all those beautiful trees in the visitor center. It's going to be great. Would you say good morning, please, to Representative Travis Clardy? This is a big day in his life today. Good morning, Representative Clardy.
Good morning. Great to be here, Wayne. I'm trying to get my camera to come on, but once again, technical difficulties. So can you see me now? I'm sorry if you can't.
Sir.
Well, it's trying to, but anyway, so I guess you're just gonna have to suffer with my voice. So yeah, a big day today, election day. We've all been waiting for this. I think we've all been waiting for it to be over as much as anything. So great turnout in Nacogdoches, so really throughout House District 11. We're expecting to break all records for previous voting history. And that's certainly true throughout the state. We have already voted statewide 9.7 million people before the first vote was cast on election day, which is 800,000 more than we had that would have been 2016. So I'm expecting us to hit somewhere close to 12 million. There are some people think we could even approach 13 million out of the 17.5 million registered voters. So this will be an interesting day. I'm predicting that I will squeak by with a victory here in House District 11. Some of my colleagues are going to be in for rougher nights in the Texas House, our Republicans. But I think Texas will stay red. I expect President Trump to win his nomination or win Texas, and I expect Senator Cornyn to win as well. So how that impacts nationally, I guess we'll all wait and see. I have no feel for that whatsoever. But it's again, it's a great day that we do this, despite some of the concerns and fears we've seen of what's happened in the last few months. I expect once again, as the world's oldest democracy, we will see a peaceful transition of power, one to another, and the republic will go on. So this will be fun. It's always a fun thing to watch the horse race, but let's don't forget what it's about. It's about protecting the land of the free and the home of the brave. And I know everybody in this phone feels the same way. So happy Election Day, and hope to see y'all tonight. There is a gathering of the Republican Party at the Fredonia with all protected, appropriate safety protocols. But I think folks are welcome to come and join if you want to. So with that, I will end my remarks and look forward to the postmortem beginning tomorrow.
Well, thank you very much, Representative Clardy, for that update. We really appreciate it. And again, we do encourage everyone to exercise their right to vote today. I do want to call your attention to, as before we move on to our next presenter, that the chat section has several resources punched in there. So please visit the chat section before you leave this forum. Would you welcome, please, Nancy Wyndham from the Texas Forest Country Partnership, the president and CEO, ran a great forum last week. Good morning, Nancy.
Good morning. Thank you so much. Regarding healthcare, as I have mentioned on one of the calls before, the region, one of our strategies is healthcare. And to kick off the regional approach, we had an event last week, and I have the link, and I will post it onto the chat session before this is over with, where you can listen. We started with Lufkin and Angelina County, and Dr. Sid Roberts wrote a plan called Vision 2030, and that was to help improve the quality of health care in the region. The Episcopal Foundation did an extensive survey of the county and the city expenditures toward health care, and we're planning on moving that into Nacogdoches County in the future. But for those of you that are interested in healthcare and want to see what's coming and what's being done, as we'll post the link of the recording of last week's session. Dr. Roberts gave an overall view of the healthcare, specifically on Lufkin and Angelina County, but the guest speaker was out of Waco, and they they came up with a plan, and it has been very successful. It's called Prosper Waco. And just listen to that when you have a moment. It's about an hour long, and that is including Q&A. It won't take long to listen to their presentations, and it'll give you a really good idea of what is coming or what we need to start working on. It's just some basic steps that I would love to bring to everybody's attention. I mentioned it to Gary, and I know Jeff was on the call listening, and Ian's on our board too, as well. So just a little focus on that as far as healthcare goes. I have put a link on the chat session about a Texas Tribune event. It's the future of rural Texas. They'll also be talking about broadband and many other elements of being in rural Texas. That's where you can go to register for that event. Also, I'm about to post the link on our website is the registration information for our annual Economic Development Summit, and that'll be on November the 18th. It's only from 8 to 1 p.m. It's not an all-day event, but it is jam-packed with a lot of information, and it focuses on broadband. And we'll have Lonnie Hunt and Jennifer Harris. Jennifer's with Connected Nations Texas, and of course Lonnie's with DECCOG. And he'll introduce their full-time person there on broadband. I did get a notice that Newton County had lifted its requirement for mask. So we'll see how their numbers are going to be doing in the future. But I'll move right along. It's already 10:43. I'll post that link and then the link where people can go and watch the healthcare. So thank you so much for this time. Appreciate the opportunity to represent Nacogdoches County in our region. Thank you.
Thank you, Nancy. And that forum last week was outstanding. If you haven't had a chance to see it, visit Nancy's website and view it. It was really eye-opening. Do want to welcome this morning Les Lenbarger, the Communications Director for the Nacogdoches Independent School District. Good morning, Les.
Good morning, Wayne, and good morning, everyone. Wayne, thanks for having me on today. Just a couple of things I want to mention. Many of you are familiar. Our sports teams are back out on the field and on the court this fall, but also our student groups are also beginning to travel for competitions. That includes academic teams, band, drill team, ag, cheer, just about anything you can think of. Just yesterday, in fact, 3 NHS debate students qualified for the UIL Congress competition at the state level. And if you're wondering what that is, a Congress competition is just as it sounds. It's an individual contest. in a large group setting that models the legislative process of democracy, specifically the U.S. Congress. And just to be sure, it models the best of that process, not what we typically see and read about these days. But this is just a reminder that many of the things that normally take place during the school year are, well, they're taking place, albeit in a different setting that places an emphasis on safety and social distancing. Also, 2 weeks from this coming Friday, our schools will close for Thanksgiving break. Now, the last couple of weeks, I've been visiting our campuses on behalf of United Way and visiting with teachers during staff meetings. And while I don't know how they feel about my presentation skills, when I do mention Thanksgiving break is almost here, everyone cheers. It's by far the most positive feedback I've ever received on anything. So I think it's safe to say that our teachers, and I'm sure our students and our parents are as well, are ready for this Thanksgiving break even more so this year. I don't think it's possible to overstate how hard our teachers have worked during this fall, and all of them are in need of the time off that's upcoming during the holidays. Wayne, that's all I've got today, unless anyone has some questions.
Any questions of Les? Les, again, we appreciate all that you and the administration and the faculty are doing to serve the education needs of our region. Appreciate that very much. Would you welcome, for the purpose of a COVID-19 update this morning, Dr. Amy Mahaffey. Good morning, Amy.
Good morning. Thanks for having me on. I am pleased to share that we have had 2 cases reported yesterday. And so we are hoping that that is reflective of everyone continuing to practice safety precautions. And we will encourage people to continue to do so. Hopefully we will not see an uptick from the Halloween weekend we just had. But as we continue into Thanksgiving, as Les just mentioned, and into Christmas, we want to encourage people to continue to practice social distancing and wearing their masks. Our wonderful fire and rescue department was able to get a lot of our gray masks that you'll start to see around town, around all of the schools this past week. And so we've already been getting really great feedback on that. And hopefully those have been distributed to all of our families that are maybe needing extras to have kind of hanging around. And then we also have some for the public to pick up at our recreation center and library. And so if anybody needs one, they're great. They look like this, and they have Nacogdoches logo on them. And so that's something that we were excited to share with the community as well. And so with that, we will continue every week to post on Tuesdays our trend lines, which appear to be pretty flat, and we hope to continue on that trend. So if there aren't any questions, that is my report, Mr. Mitchell.
Thank you, Dr. Mahaffey. Any questions of Amy? Well, thank you. And again, those reports, Amy, are very valuable to those of us. It kind of gives us a finger on the pulse of what the trends are. We appreciate them very much. Well, I do want to thank everybody, including Jeff Patterson and Gary Stokes, for being our primary presenters today. We really appreciate that. I want to remind everybody to please vote. We also want to let you know that the Chamber, along with our friends at NEDCO, will be sponsoring a program called Finding the Right Employee Right Now, which will be on November 11th at 8:30 a.m. It's a virtual program. You can register either through NEDCO or through the Chamber, but please join us for that. It's going to be a great program. And lastly, I want to remind everybody, next week, Steve Anderson, the President and CEO of the National Chain Drugstore Association, will be our primary presenter. We're going to get a real good insight as to what the distribution mechanisms will be for the hopefully vaccine once it becomes available. Again, I'll leave the chat section up for a few minutes for those of you who want to take down the information that Nancy and others have provided. And I want to thank everybody for tuning in today, and we'll look forward to seeing you all next week. Have a great week, and thank you.